Howdy folks, it's Dr. Z returning for another day of VEDA2014, Day 9. Today I'll continue my series of stories while practicing, and I gotta admit, yesterday was a little bit liberating for me, especially to talk about why your pharmacist may be a little frustrated when you come up to the counter. But like I said in my last video, I'm not trying to be another angry or cynical pharmacist. To prove that, I'm going to talk about mistakes I've made in my own pharmacy. I've made plenty, but I've chose two stories that kind of highlight how you can bounce back from a major mistake. One of them is funny, the other one not as funny. They really highlight two major things that really made an impact on the way I practice today. So I hope you enjoy. So let's start with the not-so-funny story. When I was in a pharmacy on the eastern side of Springfield, it was a kind of busy night. There was a moment where I was getting into a steady rhythm, and at that point in time, I was practicing where, at the final verification step, I would stack all these different totes one on top of the other. And just to get them off the belt, that continuously throws totes at you after technicians fill the prescriptions. And I felt I was getting a lot done because I was getting it off the belt and then I was getting them checked, and it was literally, I was making sure I was getting all those waiters done. It was boom, 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 drug, check, throw it in the bag, give it to the tech, and then they tossed it at the patient at the door. And like I said, it really wasn't that busy, and so there wasn't anything memorable about that. As luck would have it, there were two prescriptions stacked one on top of the other that were for Mobic, or meloxicam, which is an anti-inflammatory. It's kind of like a more powerful Aleve. The only thing I remember was two Mobic prescriptions back to back. There was some distraction. It may have been the drive-thru, it may have been a phone call. I just remember I was on the phone whenever those prescriptions came through. Somehow, I missed something. I didn't know it at the time. Went out to the patients, and I went on through my day. About 10 minutes later, I get a call, and the technicians say, hey, pick up that call. So I did. One of those patients calling back and saying, hey, this doesn't have my name on this prescription. That's not one thing you want to hear when you're working in a pharmacy. Wonderful. So after the most apologies I've ever had to cram into one phone call, told the patient to bring the prescription back to the pharmacy, and then I would get it corrected, give them the right prescription, and then get them the right name on that file to get a refund and everything, just to express my apologies to the utmost fashion. And at that point, it's like, well, if one person got the wrong bag, then there has to be someone else. First patient came back, did the whole rigmarole of apologizing again, getting them a refund, getting it fixed, and last round of apologies. So after we got the vial back, I figured out the patient's name, looked him up in the system, gave him a call, and said, hey, mind checking your vial for me? We may have made a mistake. She looked and it's like, yeah, this doesn't have my name. How did I miss that? That's the question I have on my mind. We fixed her as well. We gave her a refund, got her the right prescription, the right name, apologies galore for everybody. Then after that whole thing, I had to write a report on what happened and how it happened. Afterward, as I thought about it, it's like, yeah, I really need to calm down and kind of take a step back. Every prescription that leaves this door has to have my okay on it. One thing I realized was something simple, the stacking of the totes. And basically you have the totes, bop, 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 bop. That itself has so many errors because I could be grabbing the wrong vial from the wrong thing. It could have turned out really bad for the patient. But from that, I trained myself to not stack those prescriptions. For some people it may work, and for some people they're able to be very attentive to their medications. But when I get into a rhythm, I'm all about the routine. From then on, my routine was only grab one tote each time, and so that way I focus on each prescription as I'm looking at them. In that one little change, I was able to fix that routine to be able to really help myself as well as the patients to be sure that they're getting the right things at the right time. That was one mistake. Like I said, it's not that funny, but really impacted me a lot. The other mistake, it really wasn't funny at the time. Now it's just funny because of just everything around it that happened. I got stuck by a needle, and this specific needle was used in an immunization. On top of it, It was my first immunization outside of, the practice for certification. And on top of that, it was the first time anyone ever got a needle stick in that particular pharmacy for at least a decade. I gave my immunization. It was a flu shot, and it was to a couple, and the first one was like, oh, okay, good. And then second one is like, yeah, I'm really feeling good. The one mistake I made, I did not bring the red plastic tote that you're supposed to put all the needles that you use into. So it's a hard thing, so it prevents these exact things. Then I walked back into the pharmacy, having my eye specifically on those needles because I knew I don't want to get a needle stick. I got to the tote. Patient asked a question at the counter. I don't even know what the question was. I was answering it, and I kind of put both my hands into the red thing. At that moment, I stuck myself. It was in this finger here. I stuck myself just like that into the thing. It's like a splinter. You feel it, but it's not really painful until it starts moving around. I got shocked. It was like, oh, what is that? And I twisted in my finger. Oh, what? Immediately, I take it out and I throw it away, and I go to the sink and I wash my hands. For some reason, I was thinking snake bite, so I squeeze the blood out of the finger. After I calmed down for just a second, there was a friend in my class also working that same day, and I called him over. Eric, come over here. What do you need? I just stuck myself. What? I just stuck myself with a needle. Oh, okay. What do you want me to do? What am I supposed to do? I don't know. Why do you ask me? And then he walked away. It's like, Eric, what the hell? I did the best I could. I put on a Band-Aid, and then I went to my preceptor, and I said, I am so sorry. He said, what? I just stuck myself. Well, crap. There was the preceptor on site, and there was also the preceptor that was kind of managing a couple of us students. So I had to call her and said, I am so sorry. I just stuck myself. Well, crap. And I said, that's what my preceptor said. If you never had a needle stick before, you have to go through this whole process of going to some health service and get tested, you get blood drawn, you have to go through this whole rigmarole, sign document. What did I take away from that? Focus. Like in the last example. I always now bring that red thing with me anytime I do anything related to sharp stuff. I am just extremely careful in that respect. I'm not overly cautious, it doesn't freak me out. It's just, I focus. I bring it with me. I develop that routine that I can rely on. That's generally what I want to talk about today. It's focus. It's paying attention. These things help avoid mistakes. And you got to realize that mistakes will happen. No matter how cautious you are, they will happen. You shouldn't dwell on them. You shouldn't have it rule your life. And you've just got to move forward. You got to forgive yourself as well. Because, I made mistakes. I own those mistakes. I'm also forgiving myself and moving on. I've got to just focus on the bigger picture. So that's it today. This is Dr. Z signing out for another day of VEDA 2014. I'll see you tomorrow with more stories. Have a good night.